Strip number 5. We have some weird shit going on up in here. Would you agree this is just a weird strip? Like, it looks so freaking cray-cray. But you are intelligent, so as weird as it may look, you are still going to be able to figure this shit out. Watch this. Let's look at it together. We would agree that the bullshit happening on the edge of the page we don't give a fuck about. Y'all all right with that? Mm-hmm. Then we're not really sure what happened after that either. So what I always tell you to do is to go find some shit you're sure about. Okay, you are sure about this, and I'm going to come around and show you what you're sure about. Because it looks like a P, a QRS, and a T. Oh, you doing it already. I'm coming around and y'all already figured it out. See the P? That one you kind of can recognize. You agree? Yeah. And that's what you got to do in real life. Go find some shit you recognize. See what I pointed to, baby? Yes, you did it. I see it. Yup, you did it too. Amen. Get some shit you recognize. You did it. I see it on your paper. Very nice. That is the biggest trick you can do, to go find some stuff you actually do recognize. Now that little teeny tiny hump before the QRS is a P wave, isn't it? Mm-hmm. Okay, so I'm coming around here and then I'm going to go into detail. Yep. This is the first recognizable complex. You're looking for the first recognizable complex. You don't give a fuck about the stuff falling off the page and the weird shit going with it. You just trying to find normal somewhere on the strip. Y'all with me? Yeah. Okay, so watch this. We have our little tiny, smooth, small P wave. Right next to it is a QRS complex with a R that you would write on top of the spike. Agree? Then a little bit down the road, we got a bigger mountain than we had with the P. That bigger mountain is a T wave. That complex was normal. Now we're testing your alphabet memory. Are you ready? Yeah. You really for real ready? Yeah. For real, like I'm talking for real. What should have come next then if you're really ready? What should have came next after the T? P again. Another small, tiny, smooth hump. Did it come? No. What did come? A QRS. Now don't get it twisted. Just because it's upside down don't mean shit. I'm going to say that again. Just because it's upside down means nothing. The reason why it means nothing is that's just where the lead is on the patient. It means nothing. However, you're smart. You know that every QRS that we've been looking at has been real quick and spiky. This motherfucker here is wide. That is not normal. It is wide. That is not normal. You said, this is what you said now. You said after we got done with our T wave, we were supposed to get a little bitty, cute, smooth, round P wave. We didn't get it. Instead, somebody jumped the line and gave us a QRS instead that was all fucked up anyway. Do you get what I'm trying to tell you? Because check it out. What did I tell you the QRS was in the heart? Ventricular contraction. What was the P supposed to be? Atrial contraction. Atrial contraction. Would you agree that the QRS did not wait its turn? Yeah. It didn't wait on the P. It came too fast. Now you got it. It's called premature ventricular contraction. It came prematurely. It came what? Babies that come prematurely come too early. It came too early. Premature ventricular contractions. It came too early. It was supposed to wait on the P wave. And it didn't. Now, there's a second part of this, beloved. It came so damn early that it was kind of ineffective. That's why that shit is wide. Because remember what the P wave was. It was the atria sending blood to the ventricle. You ain't even wait on the damn blood. You just contracting any old kind of way. You ain't even wait for the blood. That's why it's wide. That's why it's a wide complex. Now, I gotta tell you.
So did it do it again?
Oh yeah, it did it 3 times on the strip.
Yep.
Because once you find normal, now you can kind of understand what the fuck the abnormal was. So let's do it together. And I mean together. We're going to go after, listen, we're going after this wide QRS and we're going to find normal again. Are y'all with me? Let's find some more normal. And we're going to talk about it together. Watch this. Here we go. Normal P wave, QRST. Nice little break. Normal P wave, QRST. Then a nice break. And we get a P wave, QRST. Nice little break. P wave, QRST. And no P, instead bullshit.
Yeah.
Y'all with me?
Yes.
It came prematurely. Premature ventricular contractions, PVCs.
So is this the one that's emergent if we don't hurry up?
Well, it's an order. Remember, look at your front page. It's not up at the top, but it's important. Now, I'm going to teach you something. Stay on the strip for 1 more minute because I want to show you what happens when your heart fucks up. If you look, do me a favor, if you look at the 3 PVCs that occurred in this, 6-second strip, if you look at it, right after the bullshit, you got a long pause. Every single one of them, a long pause. This one at the end, a real long pause, because look what it looked like. Upside down, right side up, fucked up, all that. Now, think it through. Your heart has malfunctioned 3 times in 6 seconds. After each malfunction, it's like, what the fuck was that? It had to take a break from anything. Don't do nothing, because I ain't got no energy. You done fuck me up with this. So notice, don't be dingy. Notice that there is a pause of nothing happening. No contraction of your atria, no contraction of your ventricle. Can you imagine? You can't keep doing that shit and still live. Okay, that's why PVCs are serious, but this is on your test. When are they serious? Only when you get greater than 6 in a minute. But don't get it twisted, this is fucking seconds. This was 6 seconds. So you damn sure on the way to getting more than 6 in a minute. So yeah, this would be a big, huge deal. Now, what if you get 1 or 2? What could it be from? Oh, you're gonna love this. You ready? This motherfucker smoked a cigarette in the car. This nut job just had an espresso. Anything, here we go. Anything that vasoconstricts will give you PVCs. So if you smoked a cigarette in the car, welcome to my neighborhood. I'm really happy to meet you. I'm waiting for your PVCs because they're coming. If you had Starbucks with an extra espresso, welcome to my unit. I'm waiting on your PVCs because caffeine and nicotine vasoconstrict. Now, I'm okay with you acting a fool and throwing me a PVC or 2. What I can't handle is if you actually have more than just a little coffee and cigarette, maybe a little cocaine to snort. Then you're going to throw more than one PVC. So the worse the drug, the more the PVC. Because we know that cocaine is a potent vasoconstrictor. It makes all your vital signs go up. Now, it doesn't have to be that you did any drug. You may have done none of them. But what it tells me if you did nothing, because I would prefer if I had something to blame on it, it would be nice if I could say, oh, they was playing in the snow again. It would be wonderful if I could say, Newport's in the damn dash. It would be wonderful if I could say, she liked her coffee. When I don't have any of those reasons, now you're worrying me because PVCs are a precursor to an MI. And 4 PVCs in a row is VTAC. I bet you better write it. 4 PVCs in a row is VTAC. And you know that's serious. 4 PVCs in a row is VTAC. This patient don't have none in a row, do they, y'all? They got one and then they skip. Then they got another one, then they skipped a whole bunch. They don't have 4 in a row, do they, y'all? No. So that would be really bad if they did, because that's VTAC now. And then you can see how I said you get more than 6 in a minute, you might be on your way to a heart attack. So once again, let me put some real world in your backyard. I'm getting report. It says occasional PVCs. Before I even got report, because I'm really kind of neurotic, before I get report from anybody's nurse, if my patient on telly, I'm looking at their telly strip. And when I looked at the telly strip, oh, fuck. He didn't have occasional PVCs. Oh, no. He had frequent PVCs. So when you get done giving me your sorry ass report, I'm going to go ahead and call the doctor. We're going to need an EKG for this shit. And then he's probably going to be discharged off my unit because ain't nobody playing with him all day. Because it's very serious to have PVCs. Now, guess what? Let's say that you work in ICU. You don't give a fuck about PVCs. Everybody in there is completely deteriorating, okay? That's a different unit. You might look at PVCs and be like, and now what? But you on the floor. You cannot tolerate PVCs just whenever the fuck the patient want to throw them. It's not cool at all, okay? And look at the front page. What does it say we got to do about some PVCs? Oxygen and check troponins. Because this patient may be getting into a heart attack. The word I need you to write next to the word PVCs. Look at what I do, y'all. The word I need you to write, watch this. I need you to write ischemia. Have you heard of that? Heard of it. Yep, it means lack of perfusion or oxygen to tissue, and that's your vasoconstriction. Okay, now, let me tell you what we did so far in case you're confused. We did strip number 1. We did strip number 4. We did strip number 6. And 5, you're right. We did strip number 5. We did strip number 6. We did strip number 7. And now we're going to do, oh yeah, we did 12. So we did 6 strips. Are y'all good? Make sure you know that. Because all 6 of those strips should have a label. Do all 6 of your strips have a label? Yeah. Okay, good job. Now let's go after some more troublemakers. Let's go after strip number 10. It does, but it's not. So be careful.
It's 6 of them, so it's not.
Well, it's kind of complex. That's why I didn't give it to you first.
Yeah, this is
It's a little complex, okay? Now, here's what I want you to remember. When I started y'all off today, I said there needs to be a smooth, small, cute P wave. Remember that? Mm-hmm. Then I said it needs to be hugged up right against a QRS. Well, now let's see. Do you see any smooth, soft, cute P waves?
No.
Yes. I see a million of them.
P wave? Yep. Let me turn it around.
And not all of them are hugged up. Some are just doing their own damn thing out there in the wilderness. Do you see how some of them, there's a long break after them? Yes or no?
Yes.
Look at what I'm doing. I'm going to show you. We're on strip number 10. Forget the complex falling off the paper. Forget it. Let's find our P wave right after it. Do you see it? Yeah. Yes, no, maybe.
Yes.
It's just tiny. It's out there hanging out by itself. It was supposed to be hugged up against a QRS, and this motherfucker took too long. Are you in agreement? Mm-hmm. Now, remember what I told you. The upside down nature, you don't care. You only care that the P wave is not hugged up against the QRS. Y'all feeling me on that? Mm-hmm. I said something earlier when we started the EKGs. I said if the P wave is not hugged up right next to the QRS, and instead the P wave is followed by a pause, I told you it was heart block. This is heart block. Because how many P's that you see are not hugged up? Let's count them. Here's a P not hugged up. There's a P wave not hugged up. There's one. Only got 3 that's not hugged up. I don't know where all y'all looking. I got 3. The other 2 are hugged up. The one at the end is hugged up. The third complex from the edge of the paper is hugged up. Are y'all with me on that? Now we got a big problem as well. Here's our bigger problem. There is no pattern. It's just whenever it wants to, there's a pause. There is a very big problem anytime I can't find a pattern. Are you still with me? Whenever there's no pattern to the crazy, it's bad. Not to mention, if you look at this closely, these QRSs are wide. They're really wide. They are not. They're not. They're boop, boop. They're like wide. You have unpredictable pauses after your P wave and wide QRS complexes. This is not just heart block. This is complete heart block. This is horrible. This is type 3. Complete. Ain't shit communicating with each other. In other words, when you have electricity in the heart, the P wave and the QRS is posses, okay? They are bosom buddies. They're supposed to talk to each other, hang out with each other, discuss life with each other. These motherfuckers ain't even talking half the time. They ain't got no communication going on. Ain't no pattern to the shit. You can't say it's every third one. You can't say it's every other one. It's just fucked up. It's unpredictable. This is complete heart block. Now, write down a rule. Never, ever, 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 and then add 17 more nevers. Never see heart block first. Never see heart block first. It ain't even on my front page. Yeah. Now, Picture what you just saw. This heart block, no communication, stupid as fuck. Do we even use atropine for this? No, it's so unstable. You definitely symptomatic, okay? Let's just put that out there. You definitely feel really weird with this. So let's just go ahead and get them transcutaneous pacing and keep it moving. Okay, because remember, heart blocks and Brady's get atropine or transcutaneous pacing. The more unstable they are, the more transcutaneous pacing. This is super unstable. It's complete. Transcutaneous pacing. Make sure you know it. Now let me show you something to show you how different heart block can look. Are you ready? Let's go to strip number 13. Strip number 13, if you aren't intelligent like you are and had the blessing of a crazy fucking teacher, you might look at this and say, well, Shelly, that looks normal. But since you did have the blessing of a crazy fucking teacher, you know that what is too far away from what? The P waves are too far apart from the QRS because they were supposed to be damn near on top of each other. So guess what? Because it looks so normal to the naked eye, unless you really look at it, because you would agree the QRSs are nice and narrow. The rate is decent. The P and the T are relational, so the P is small, the T is bigger. The only thing out of whack is there's a little bit of a pause after every P. But otherwise, to the naked eye, it looks really normal. You know why? Because this is first-degree heart block. It's not concerning to me at all. It's first-degree heart block. The other one we looked at was third-degree, remember? This is first-degree heart block. First-degree heart block is like, oh, that's cute. My dad got first-degree heart block. I took his ass on a cruise so fast. Come on, you going with me? So, I mean, like, I don't care. Okay, so first-degree heart block is who gives a shit. Okay? Now, these patients are never symptomatic. It may be just caught on an EKG like it was for my dad. And if that's true, I don't care. If in a rare situation the patient kind of got a little symptomatic, like dizzy, syncope, remember that symptom? I told you that symptom was cardiac all day. Yep. If the patient did have a little kind of lightheadedness, we would just put a pacemaker in them. Just throw a pacemaker in them. They'll be fine. Make sure you know it. Pacemaker is the treatment. Okay, now your life becomes more difficult because I gave you all the easy strips I could. It's time to put your big girl panties and your big boy drawers on. So if